Welcome to the Prepped and Polished podcast, the podcast that empowers you to take control of your education, featuring weekly interviews with influencers in the world of education, as well as tutoring tips, lessons, and updates. And now, here's your host, Alexis Avila.
Welcome back to the Prepped and Polished podcast. This is episode 267. This is Alexis Avila, your host. Make sure to join our Prepped and Polished community. You can find us on Instagram, TikTok, YouTube. Just type Prepped and Polished. You'll find us. Go to preppedandpolished.com if you have any questions. And if you want admissions consulting, check out preppedforadmissions.com. If you have a question or reaction during or after this podcast, email me directly, alexis@preppedandpolished.com. On episode 267, I'm speaking to repeat guest Shirag Shemmassian. Shirag also appeared on Prepped and Polished episodes 152, 184, and 250. Shirag Shemmassian is founder of admissions consulting firm Shemmassian Academic Consulting. He's a Cornell University graduate, former Cornell admissions interviewer. Shirag knows what the best schools are looking for in prospective students. On today's episode, Shirag and I talk about colleges that offer fantastic pre-med programs. If you're considering becoming a doctor, you'll want to tune into this episode. You're going to learn things like direct med programs and why they're so hard to get into, the types of majors you should pursue if considering pre-med, the one Ivy League school that offers a direct med program, and the number one reason that causes some pre-med students to drop out. And of course, I'm going to ask at the end, Shirag, some words of wisdom for teens listening to our podcast. For another related conversation, make sure to rewind to episode 152, also with Shirag, and he talks about college committees and how they evaluate applications. So enjoy this podcast, and let's get right to our guest. This is episode 267 with Shirag Shemmassian. Enjoy. Shirag, welcome back to Prepped and Polished podcast. How are you doing today?
I'm well, Alexis. Thanks for having me again. How are you?
Welcome back. Good to see you. So what have you been up to recently, and how are things at Shemmassian College Consulting?
What have we been up to recently? Well, continuing our work in helping students get into, great undergraduate institutions, both, traditional undergrad programs, as well as, direct med programs. That's a big area of focus for us, as increased competition with medical school admissions, families have been more and more interested in helping their students, receive assurance earlier on. And so we've been working a lot on those. In addition to that, we've been developing a lot of digital resources that our families can access sort of on demand. For instance, like college essay libraries that have been very valuable in helping students understand all the different ways that they can frame their own story by seeing other people's work, along with, analyses of why some of these essays work. And we found that that's been very valuable as well, because as we know, it's sometimes hard for us to understand how we should present ourselves and how we should write about ourselves, but then seeing how others have done it really opens our mind. And so we've been developing those kinds of resources to really ease the process to go alongside our one-on-one support.
Yeah, I find your website just so full of just helpful, just content, free content, and you do a wonderful job with that.
Thanks for saying that.
So let's talk pre-med. I was a pre-med major. I changed, but that's another story. But for students who might be interested in becoming a doctor, what kinds of steps are you thinking of? Do they need to take to get there?
Yeah, so focusing on students who are in high school, we have to understand, what the different paths are to get into medical school, first and foremost. So for most students, they're going to attend a traditional, 4-year college or university, and then they're going to complete various requirements for pre-med. These are going to include courses in bio, chem, physics, and math. We call them BCPM or science courses. They're usually going to have to get involved in extracurriculars like research, as well as patient exposure, otherwise known as clinical work, community service, physician shadowing. And ideally, those experiences will be cohesive, meaning they'll be aligned in some way, shape, or form rather than seeming like disjointed pieces on an extracurricular profile. Now, the other path to medicine is not through traditional four-year undergrad and then applying to medical school, but rather going through what we call direct med programs, sometimes known as BSMD programs, where a student is admitted to the undergraduate institution and provisionally the MD program associated with that school. I say provisionally because there are going to be some expectations as far as maintaining a minimum GPA. Sometimes there's a minimum MCAT score required. Sometimes the assurance is not acceptance into medical school if you meet those criteria, but rather assurance of an interview for that medical school. So there's a lot of nuance that we'll need to unpack. But if you're looking to go into that direct med route, then your high school experience should look different, meaning you should look to secure some of those research experiences, clinical and service experiences earlier on in order to make sure that you're very competitive for those BSMD programs, which are, some of the tougher ones to get into.
Wow, that's awesome. So let's talk pre-med programs in college. Like Michigan, where I went to college, had a pre-med program. Now, do all colleges offer a pre-med option?
Technically, yes.
Okay.
So colleges and universities, there used to be more of a, quote unquote, like pre-med major or pre-med, path kind of thing. It's changed where there isn't an official like pre-med major. So you can actually pursue any major in college. And so long as you fulfill the med school requirements, some of the course requirements we talked about. So again, biology, chemistry, both general chem and organic chemistry. There's physics, there's mathematics. There's also going to be usually recommended courses in biochemistry or English composition. Sometimes even a social science course may be required or recommended. So there are some of these requirements, but whether you're a life science major like microbiology, or maybe you're even an art history major who happen to take those BCPM courses outside of the art history major path, you can be on that pre-med path. So long as you fulfill the academic requirements and the extracurricular expectations in service of getting into medical school, you are pre-med. You don't have to have a separate designation at your school. You don't have to pursue a separate major at your school. It can all be done that way.
Wonderful. Now, what do you not want to look for in a pre-med program? Are there any red flags there that come up
when selecting colleges or universities to attend? Yeah, the big thing is you want to make sure that you're attending a school that can support the experiences you want to have. So making sure that you attend the school that has, professors who are conducting, medically relevant research. It doesn't have to be necessarily clinical research, but, research that has eventual medical application, for instance. That may be, basic science research, that may be clinical research, that may even be something like health policy research, which is going to have an impact on the medical field, even though it's not, about one-on-one patient care or something like that. So you want to make sure that there's an institution that will support that. As far as clinical and service work, sometimes parents will wonder, well, is a university going to support my students, clinical or service pursuits? Yes and no. So even if you go to a school that has an associated hospital, for instance, or an associated medical or something like that, that's not a guarantee that your child is going to be able to secure clinical or like medical community service experiences through the associated hospital. So for us, whenever we advise students, even if a university doesn't have an associated medical school, there's still going to be plentiful opportunities to do community service work and clinical work in the area. Like there are certain prominent schools like a UC Berkeley that don't have an associated medical school, but there are plenty of opportunities in that area where students can pursue that work. So I would say academically, most colleges and universities are going to offer the undergraduate coursework that's required for medical school. And then extracurricularly, you want to make sure that there are faculty that are going to be able to, support your son or daughter's experiences. That's really the key. Now, sometimes parents also wonder if it's a benefit for a college or university to have a pre-health advising office or a pre-med advising office. I would say
Oh.
minimally, and usually those are private schools that have those types of services, and they may be involved in helping to prepare like a committee packet when a student eventually applies to medical school, where they compile letters and things like this. But overall, you can attend any school and have great success. I mean, we support students both across public and private universities with getting into medical school. So to me, the pre-health advisory service, it can be helpful, but I wouldn't use it as a make or break decision making factor. And on that note of pre-health advising offices, I always want parents to be educated consumers of what colleges or universities they support their son or daughter in attending, because sometimes when a school has a pre-health advising office, their stats that they report to families about the percentage of students who get into medical school from their undergraduate institution, those numbers may be a little bit skewed. What I mean by that is, a pre-health advising office can review a student's application, sort of say, yes, we're going to endorse you, or no, we're not, and then basically stack the deck in their favor. We're saying, okay, we're just going to pre-vet some of the best students, endorse them, and then when we report a 85 plus or 90 plus percent acceptance rate from our institution, that's only looking at the students that we pre-endorsed, not all of the students who applied from our school necessarily. So that can really change numbers. So sometimes you see these wild swings of a private institution saying, well, 80+% of the students who applied from our school got in, but then a public institution might have a 40% number, and the parents will think, oh, the private institution is doing a better job of helping students get into medical school, where overall, when you look at the numbers, that may not actually be the case.
Oh, wow. That's really helpful. Let's rewind just back to high school. So you're a high school student, you're interested in pre-med programs. What types of grades do you need in high school to get to consider these pre-med programs? Do you need to be strong or have a proclivity in the math and sciences?
Okay. It depends on the path you're looking to take. Again,
Okay.
if you're looking to get into a BSMD program, or like, what we're calling a direct med program, where it's these 6, 7, or 8 year sort of combined programs, you have to have off the chart academic performance. So usually getting into a direct med program is as difficult as getting into like an Ivy League school or a Stanford. It's at those levels. We're talking single digit acceptance rates in most of the cases. Now, when you're looking to get into a traditional undergrad, then it's not like it's special for people who are aspiring physicians. So if I'm looking to get into a 4 year university, getting in as a potential pre-med student, we haven't found is more or less difficult than if you're trying to attend that institution as a not pre-med student. For instance, if I'm trying to go to the University of Chicago, it's going to be as hard for me to get in whether I will want to pursue pre-med at University of Chicago or whether I'm doing something other than pre-med. So the same admissions rules and best practices apply for traditional undergrads. For direct med programs, you have to be at an elite level. You also have to demonstrate interest in the medical sciences, like I said, through research and clinical and service work, because they're essentially saying, okay, we have this 17, 18-year-old applicant. How confident are we that A, they are going to continue on this academic path of high performance, and B, how confident are we that their commitment to medicine will persist? They're trying to extrapolate out or model out at age 17 or 18 that this person at age, let's call it 26, is still going to be committed to medicine, right? So they're trying to make an educated bet, but there's still uncertainty. So you have to demonstrate in high school, no, I love this stuff and I'm going to stick with it, not only for the next, few years, but throughout my career. And so schools want to see that multi-year demonstrated commitment to the field of medicine in order to feel confident that you're going to stick with it.
Two just aside questions to direct med. How long are those programs, and what are just like, can you just name a few schools that offer that just off the
Sure.
top of your head?
Yeah, sure. So they're going to range between 6 to 8 years. Typically, and unsurprisingly, families will be more attracted to the 6 or 7 year programs, but most of them are going to be in that 8 year range because institutions
Yeah.
want to have 4 years of undergrad and 4 years of medical school, and families want to see, well, if I can get this done faster, hey, why not? I'm gonna pay less tuition, and my son or daughter can begin residency and their career earlier. As
Yeah.
far as programs, they're across the country. Now there is going to be more clustered, I would say, in the Northeast generally than in the West, for instance. For instance, in California, there's only one program at Cal North State. But then they're going to be all over. There's going to be University of Missouri, Kansas City. There's going to be several in New Jersey associated with the, Rutgers Medical School. The one Ivy one that has a BSMD program is Brown, which is among the most competitive, if not the most competitive. So that one is called PLME, otherwise known as PLME, among students. But really, a
Got it.
lot of these programs have also, trailed off in number over the years. For instance,
Sure.
Northwestern used to have one that doesn't have one anymore. And so, people are scrambling. There's increased demand for, I guess, decreasing supply. But they're all over the place. Again, you have like VCU, Virginia Commonwealth. They're all over the country.
Wonderful. Um, what are we talked a little bit about the course load. You said organic, chemistry,
Mhm.
inorganic, biology. But what in terms of the course load, like how much more work should an aspiring pre-med student expect compared to maybe LS&A?
Yeah, it really depends on your chosen major. So at most
Sure.
universities, Alexis, if you have a life science major, so I'm defining this as like biology or microbiology or neuroscience, or one of these types of majors, universities have sort of structured those majors to pretty much perfectly align with what a medical school's requirements are. So, in other words, if I go to a certain institution and I do a bio major or a neuroscience major, chances are just by doing that major, I've already met all the pre-med requirements. I don't have to do anything different than
Wow.
a non-pre-med bio major, for instance. It starts to get tricky if I'm doing something different. So, for instance, if I'm doing an English major or even a math major, I may not, for the math major, need as much life sciences or even, chemistry as a bio major would. And so I'm going to need to look at the math major requirements and say, okay, which of my pre-med requirements does the math major fulfill? And how do I need to supplement that with additional courses to make sure that all of my courses align with what medical schools are looking for? So if you stick with the life science path, pretty much it's going to be taken care of for you as far as meeting all the pre-med requirements. If you do something other than life science, we need to dig a little bit deeper and see how we need to supplement.
Perfect. Wonderful advice. Um, and then what are some of the reasons that you find that students drop out of pre-med majors? And what does it take to stay in?
Yeah, sure. I actually get this question from parents with some frequency, especially early on. So if you're gonna, you're having a son or daughter enter their first year of college or second year of college, and sometimes families are worried about, what is the likelihood that they'll stick with this path. In my experience, based on what I've observed, the number one issue, leading to a student dropping out of pre-med is they struggle with their academic coursework, especially during their first year. And so what
Sure.
ends up happening is, students will come to college, and even if they were, well prepared in high school, one of two things will happen. Either they will take on too heavy of an academic load in their first year, thinking, oh, like it's fine, I'll take that extra class, I can handle it. But they're not really used to the rigor of college or sort of the self-pacing of college, because there isn't going to be a daily assignment like you have in high school. So you need to be hyper organized as a student to make sure you're getting everything done in advance, even when your mom or dad or your professor is not telling you what you need to do that evening. So making sure to do required reading and practice problems and these kinds of things. So what ends up happening is they take on too much. They will struggle during their, first year, and they lose confidence, where they say, oh, like, to recover my GPA, I'm going to have to get A's the rest of the way through college. And based on what I saw in my first year, that's unlikely. So let me just, let the dream go now. The other reason is related but somewhat different is they'll take on too much extracurricularly or socially where they won't study enough, again, leading to the drop in grades. So the
Yeah.
drop in grades during year one is the number one reason by far that I've observed people leaving the pre-med path. It's extremely rare, on the other hand, for a student to do very well in years one and two to then say, I'm not really interested in medicine anymore. In other words, people who are handling the academic rigor well rarely leave the pre-med path when they came in interested in medicine. So essentially, this is an issue more with confidence that a student can eventually get into medical school rather than losing the interest in medicine. So usually the interest in medicine is not gone, it's that the confidence is gone. And so that's why whenever we're advising students through the pre-med path, from undergraduate into medical school, one of the biggest things we focus on is protecting our students in that first year, making sure to work towards their pre-med requirements, but not going overboard academically or extracurricularly, because we want to make sure that they're getting through first year with a high GPA and then working through the rest of college to maintain that, and also taking on extracurriculars at a very, manageable pace in order to never feel overwhelmed. And of course, as time goes on, you can increase the load somewhat because now you're accustomed to the flow of college, and that becomes less of an issue over time.
Wonderful. And I bet that you have, after you're done with the college consulting piece, they come back to you, I would imagine, and for a little bit more support.
Yeah,
Right?
that happens often. Yeah, you help a student get into, undergraduate, and then they're looking for assistance, through the college years and into medical school. Or sometimes we help an older sibling get into, a great medical school, and they say, "Oh, I actually have a younger daughter who's also looking for help with college
Oh, there
admission."
you
So
go.
that happens as well. And that obviously that's like the biggest honor, the biggest
Yeah.
compliment, when you can earn enough trust and show families results, they're going to feel very confident.
Wonderful. Shirag, what's the best way for us to get in touch with you?
Yeah, so you can always send an email to contact@shemmassianconsulting.com. I know that doesn't roll off the tongue, so I'm sure you'll include links, to the website. And there's a contact form in the top right corner of our webpage where, family can also fill out a form online, and then that'll reach us, and then I'll be able to get in touch with them soon.
Awesome. And one way that helps me know your last name spelling is 2 M's and 2 S's.
That's right. Yeah, double M, double S. Exactly right.
Any advice for teens listening today who are getting ready for young adulthood? Words of wisdom.
Young adulthood, words of wisdom.
Yeah.
I think it's important for students to get a sense of two things as they're sort of navigating what they might want to do with their undergraduate education and career, is start thinking about, certain populations that you're interested in serving and certain problems that you're interested in solving. I find that a lot of students will put pressure on themselves to quote unquote discover a passion as though it's something that's going to hit them over the head one day. But I find that that's not the case. It's more so understanding, areas of interest to you, people and issues that you're interested in working on, and working towards those and saying, okay, am I confirming that I am really interested in this, or maybe not? And, being okay with understanding that things that you're not interested in are also very helpful in guiding what your next steps are. So don't put so much pressure to try and, figure out what my passions are, but rather take educated guesses of, well, based on populations and problems of interest, I'm going to, explore some of those opportunities, see if I like them. If so, ask myself, what do I like about them? Continue pursuing that. And if I realize, no, I don't like it, then ask myself, okay, where can I pivot to instead? So just make sure to use those years to iterate and ask yourselves, what you like and why, and then based on that, you'll get to somewhere you'll be happy with. I know, I'm sure, speaking with you, Alexis, and speaking with any parents, most people will agree that what they do now, career-wise, was probably not what they thought they were going to do at an age 16 or 17 or 18, or even interest in college, or even within medicine change over time. Even people who go into medical school thinking they're going to do a certain specialty end up switching. So just retaining that openness to changes and constantly asking yourself, do I like this? If so, why? If not, where can I pivot instead? And being comfortable with iterating.
Wonderful. Thanks for coming back, Shirag, on the Prepped and Polished podcast, and appreciate your time.
Absolutely. It was wonderful being here. Thank you.
And this wraps up our show today. This was episode 267 with Shirag Shemmassian. To contact Shirag, check out ShemmassianConsulting.com. Episode 268 is next, so stay tuned. And to access the episode today and all of our podcast episodes, it's really easy. Go to preppedandpolished.com/podcast. This is Alexis Avila. Thank you for joining us on Prepped and Polished Podcast.
You've been listening to the Prepped and Polished Podcast. For more information, check out preppedandpolished.com. Thanks for listening. Class dismissed.